Good evening. New York's famed skyline enveloped by an eerie and dangerous pall of smoke as we come on the air tonight.
Canadian wildfires are causing an air quality alert for the tri-state area for a second day, posing a health concern and danger to millions of people.
Millions of Americans are on alert, being urged to stay indoors as much of the Northeast is experiencing the worst air quality on record since 1999.
This is actually probably the worst I've seen the numbers.
If you were in New York City 2 summers ago, you probably remember that day. The sky was orange, the air smelled like a campfire, the Canadian wildfire smoke took the Northeast by storm, and everyone was asking the same thing.
Is it safe to go outside?
Should I wear a mask?
When will the air clear?
What does this mean for my health?
Where can I get the latest info?
We live in a time when our environment, the air we breathe, the heat in our neighborhoods, even the public spaces around us, directly affects our well-being. But making sense of all of that information isn't always easy. And today, people have come to expect more. They're used to seamless, user-friendly digital experiences, the kind that gives us clear, real-time updates on our commute, our groceries, even our mail. So when it comes to government data, the public expects that same clarity and accessibility, especially when it's about their health. So, how can we break down complex government data into something that people like you and me can understand and actually use? How do we make a city's residents more informed, more prepared, and more empowered to make healthier decisions? Well, today we're talking to someone who's made answering this question his mission. This is Empathy Affect, Forsmarsh Media's podcast that explores the human side of government. I'm Melissa Sosinski, and joining us is Matthew Montesano, Senior Director of Data Communication at the New York City Department of Health and Mental Hygiene. Within the department's Bureau of Environmental Surveillance and Policy, he leads the team behind the Environment and Health Data Portal, a website designed to give New Yorkers insight into how their environment impacts their health and what they can do about it. We'll talk with him about how to turn data into storytelling to inform, engage, and protect the public, and why helping people become informed consumers of public information is more urgent than ever. Matthew, thanks for joining us today on the show. I'm really excited to have this conversation.
Thanks for having me. Me too.
Yeah, so you've been serving with the New York City Department of Health and Mental Hygiene for almost 7 years now. So tell me a little bit about your role in the department and how it touches and impacts New Yorkers.
Sure thing. So my title is the Senior Director of Data Communication in our Division of Environmental Health, and I work in an area called the Bureau of Environmental Surveillance and Policy. And my job in this bureau is to manage a website called the Environment and Health Data Portal, which is one of our agency's marquee data communications platforms. We use this website to publish and communicate data about how the environment affects our health. And it's important that we do that, but it's also important the perspective that we take on the environment. A lot of times if you ask people, what's the environment? They may say, okay, it's, chemicals in the air and it's the ground and it's the water. But really the perspective that we take is that the environment is more than that. It's the whole world around us. It's all these things in our neighborhood that can either keep us healthy or expose us to health risks. So when we publish data about the environment, we're publishing data about air quality, but also about our built environment, like parks, streets, and buildings, and about the social and economic environment, trying to illuminate how the environment, how place, and how inequality affects our health. On this website, we try and publish data so that anybody can understand it and use it. It's not just for researchers or for health professionals or for data scientists, but for everyday New Yorkers who are curious about their neighborhood, the world around them, and want to understand the city through this lens of data. Ever since the COVID pandemic started, we've seen more and more people interested in health data and interested in what the government is doing about this issue or that issue. We found that when we put data out there, we're filling a need, we're demonstrating that we're on it. And when we make data easier to access, understand, and use, then more people can understand it, more people can use it to improve health.
Matthew's drive to make public health data accessible and easy to understand came from a nexus of experiences he had in his career. He started off as a community organizer in the nonprofit sector, then became a grant writer where he had to describe programs and strategies to help get funding. As he moved into public health as a health communications professional, he had to focus on plain language and web usability. He realized that these lines of work had great overlap. Data seemed complicated, but didn't need to be. How do you get to making it understandable for the average New Yorker, though? Matthew explains that his team first determines topics of importance to the Department of Health and Mental Hygiene, like air quality or food and drink, and then they seek data to paint a picture around those topics on the Environment and Health Data Portal.
In my work on the Environment and Health Data Portal, we try and publish data as a service to these other programs in the department, trying to do things that meet a strategic need for these different programs or research areas. And as we're doing that, we think less about how do we explain this data, how do we communicate this data set, and we think a little bit more about what does this say about the city? What does this say about neighborhoods? What does this say about this topic? And what other data do we need in order to present a really well-rounded view of this? So one example of that is the injury prevention program. And my colleagues over there are collaborating with the city's Vision Zero effort. And one of the things that they're doing is keeping track of emergency department visits and hospitalizations because of traffic to people on foot or people on bikes. And so these data on cyclist ED visits and hospitalizations and pedestrian ED visits and hospitalizations, that's really valuable. But when we look at that in the context of other data about the built environment, so the percentage of streets that have bike lanes, or when we look at that in the context of other data about people's driving behaviors, like people who report speeding or texting while driving, or overall levels of different transportation activities, right? So we can get data from the American Community Survey about the percentage of people in each neighborhood who say that they walk to work or cycle to work or take transit or drive. When we look at these health data in the context of other data, we start to explore ways that we can create a well-rounded sense of a topic rather than just have this sort of laser focus on a single data set. We've also found that when people are searching for data, they're browsing. They're not searching like analysts. They're not searching like an analyst who's thinking, oh, I want a specific indicator from the Sparks data set with all that prior knowledge about the sort of underlying scaffolding and how that's organized. Non-professionals, the sort of lay audience, the lay data user or the naive data user, is browsing with a much more general question. And that question might be, what's going on in my neighborhood? What's going on with asthma? What's going on with street safety? And so when we organize things by these well-rounded topics and we let people browse by those well-rounded topics, it gives them an opportunity to explore these issues through this topic lens, which frankly makes more sense to more people than just through the lens of a strict look at a single data set.
Working at the intersection of data and communication, what is then your approach for turning the various sources of raw data around a topic into compelling stories and information that is usable and that resonates with the public?
I think the most important thing that we do, and I think almost the most important thing that anyone in the situation can do, is to tell people what we see in the data. In my past experience, I've heard people say, well, our job isn't to provide interpretation. Our job is to just put the data out there and let other people draw their own conclusions. And I think that's really flawed. I think that's an abdication of our responsibility as experts. Mm-hmm. When you do that, you hope or assume that anyone else who comes across these data will have a similar level of expertise as the literal actual experts working on it, and that they'll look at data and draw the same conclusions. I think it's important to not let the data speak for itself, but to speak for it, to accept the role as the experts and say, here's the data and here's what it means. People want that. When they're exploring a topic for the first time, I don't think that people really want the experts to be cagey and not tell them what it really means. Tell people what it means. That's the best and most valuable shortcut to creating meaning in data, is to tell people what it means. We also try to remember that what's inside the data are people. There are human stories in there, and we want to tell a human story and have a human approach on data. We want to use data to reflect familiar aspects of the world around us. So we also use techniques like audio clips and images and just a voice and tone where we're speaking to our audience as you and explaining the data, just to make it all a little bit more approachable. Data can be scary to a lot of people. And inside a health department or inside a profession, it's super easy to overestimate the data familiarity or the ability to, draw conclusions based on data among our audience. So it helps a lot to focus design techniques that go the extra mile and sort of reach your audience rather than expecting them to come to you, which incidentally is something that I learned in the beginning of my career as a community organizer. You go to where the people are at.
I'm hearing that, on one hand, you are advocating for authoritative information through data, like telling people how it is, very clear. But in order to do that, that also requires a level of trust that you need to build. I mean, I feel like you could build trust through intuitive design too. So how do you design your platform so that people trust and can understand your data?
There's a saying in the web development and web usability world that the vast majority of time that people spend on the internet isn't on your website. It's on every other website out there. And so those are people's norms when they're thinking about their web browsing experience. One way that we try and build trust is to have a familiar web browsing experience, to develop a website that looks and feels like a lot of the rest of the internet, where the navigation is predictable, where things aren't harder than they need to be, and where the visuals are appealing and compelling. It's really easy to overlook techniques like this because they seem sort of soft or not as rigorous and involved. But if people come to your website and they bounce because they don't like how it looks or how it feels, you're never going to get the opportunity to connect them to the important content that's in there. I think that trust is such an important part of government services right now. With data, there's a huge opportunity to either get people's trust or lose it. When people think that you have data and you're not making it easily available, that's a huge loss of trust that can happen there. People may think that a government agency is not being responsive to a public crisis, or they may think the worst and think that data are being suppressed for nefarious reasons. When you're not sort of stepping forward into an information vacuum, a lot of other things can thrive. So by trying to create this easy to understand data web content, we're hoping that we sort of can start to build a little more trust in the public health lens on contemporary issues.
Yeah. I mean, just hearing you talk, I've visited so many different government websites, and they have data repositories and dashboards that, upon initially looking, I'm like, I don't know what to do with this, just as a layperson. And I know they tend to be geared toward researchers or public health professionals. I know that through the history of the environmental and health data portal, it initially started as more of a researcher, public health professional geared platform. But since you've been able to iterate and design on it so that it is geared toward the public. So do you want to walk me through some of the user research you've done to help get to this point? What's been most effective in developing it so that it is usable for the average New Yorker?
Yeah, and I'm glad that you asked about user research, because I think that that's a really invaluable tool for figuring out what you need to do and how to do it. So the Environment and Health Data Portal got its start through a CDC program called the National Environmental Public Health Tracking Program, which started some 20 or 25 years ago, funding lots of states and New York City to do research connecting environmental changes to health outcomes. super important work. There had been no national level coordination on that issue prior. And one of the grant requirements was to publish your data sets on the web so that other people can also take part in that work, can use those data and do additional research. So the first iterations of the Environment and Health Data Portal prior to my time at the New York City Health Department were very much geared towards fulfilling these grant requirements and publishing these data and publishing data for other researchers to use. But it became evident that there were some more opportunities that we could make the most of with this tool. And we started doing user research, so working with users of the website and trying to see what information they needed. What were they doing when they were looking up data? And how can we give them data in another way, in a better way? And we found a lot of really interesting things through that process. First was that we were trying to show connections between the environment and health, but we weren't actually putting these data sets together in a way that showed those connections. We were just making a bunch of data sets available. So we had to think through ways that we could really explain what's connected and why. We found that a lot of people told us that they wanted to know the top level, bullet points, the top line. People wanted us to tell them what was going on in the data set. And people wanted a system that was easy to use. They wanted to be able to click around and explore and read about things and download things and save visualizations and look things up by neighborhood, not only by data set. So we, over the past bunch of years, embarked on a pretty significant effort to continuously do user research and continuously design in order to meet the real needs that we were observing. And so we started creating a bunch of explanatory content on the website. So not just this sort of exploratory content where people can automatically, get and visualize data sets, but also creating things like data stories where we're walking people through interesting issues and really shining a light on findings, or little one-off focused dashboards where we allow another layer of interaction and manipulation with data sets in a way that can communicate a specific topic. Trying to look into really creative ways to serve the communication needs of our programs and of our researchers. We've been doing usability testing, trying to understand and quantify how well the website lets people browse and explore and looking at sort of big issues, right? Do people get to the things that they're looking for, as well as really little issues, right? Do people see these buttons? Do they interact with these options? And if not, how do we redesign them so that they can sort of find some of those other details? 2.5 years ago, we launched a really major redesign of the website. And ever since then, we're constantly refining and improving it, changing how it looks and how it works, and doing more user research and planning out, the next version of this function or that function on the website, or trying to make it more accessible, all for the sake of giving people easier and better ways to get at these environmental health data.
Yeah, I mean, I've clicked around on the portal a bit, and it's super fun to see. I love the data stories. It's almost like bite-sized ways of consuming information and data, which can often feel very abstract and overwhelming. So love your approach, and thank you for walking us through some of the way you iterate and design the website. Just thinking about the translation of data to the layman again. Before, you were telling me that you don't only want to use the language of data, but you want to use the language that most people speak. We've talked really big picture overall, but can you share an example of what something may look like in the language of data, and then how you end up translating that to present it in the way the common person speaks?
Yeah, certainly. I think that the air quality data that we have on the website is a great example to dig into this. And I really like talking about the air quality data because the work that my colleagues in the air quality program do is so fascinating. So they can't measure air quality everywhere in the city year round. That is logistically prohibitive. What they do is they measure air quality for 2 weeks each season at something like 100 different locations throughout the city. So they get these samples of seasonal air quality at these individual locations. And then they look at all of this other data on things that can affect air quality. So sources of emissions, truck traffic, building emissions, population density, industrial areas, restaurants that have charbroiler permits, and so on and so forth. Because they don't have air quality data for the whole city, but they have this other data for the whole city. So then they combine this in like a complicated model, and the output of that is anywhere that they don't have an air quality monitor, if they know all of these other factors, these sources of emissions, then they can really closely estimate or model what the air quality is in that area. And so communicating something like this, if you talk about modeled air quality, or if you talk about, seasonal samples, or if you talk about land use regression models, they make my eyes cross because I easily forget a lot of the details of that. But we think that we can explain that. So we have a page on the website called Your Neighborhood's Air Quality, where you can look up your neighborhood. You can look it up by neighborhood name or by zip code, and it tells you the PM 2.5 and the NO2, and it explains this process of modeling, that if we don't have an air quality monitor in this neighborhood, as long as we know these underlying factors, we can estimate it pretty closely. And so we do things like that, sort of trying to peel back the curtain on some of these analytical processes so that someone who's motivated can dig a little bit deeper into things like this, or things like the heat vulnerability index, which is a 1 to 5 score that neighborhoods get based on the risk of dying due to extreme heat. So projects like that are ways to kind of help take people's hand and lead them a little bit further on the path and make those complex processes a little bit easier to understand so that the data are easier to understand.
Yeah. You were talking about air quality, the heat index. I imagine that those are, topics that get a lot of traffic on your site, but which topics do you find get the most engagement from the public? And do you notice any patterns in what people search for or interact with most?
Yeah, the air quality data gets a lot of traffic. A little under 2 years ago here in New York City, we had this summer where there was wildfire smoke blanketing the city. You would open your you'd open your curtains and it would just be an orange sky outside. It was sort of terrifying. And during those several sort of periods where there was a fresh blanket of wildfire smoke, we noticed people going to our page on real-time air quality, orders of magnitude more traffic than we were seeing usually. So that was really satisfying, knowing that, there was something going on and people were seeking information, and we were able to provide it. We had the right information that helped people make sense of what was going on in the city around them. Mm. We've also seen a lot of interest in material that we've put out that takes a look at violence as a public health concern, that focuses on the experience of violence as a health concern and something that can be predicted or understood by other environmental variables, rather than violence as a criminal justice issue or something that's perpetrated, right? This violence as a health experience. People look at that a lot. And then we also have published some information about redlining, which is a really useful way of understanding housing quality, which is a very helpful way of understanding certain health outcomes like asthma. It's interesting. For those who don't know, the 30-second version of redlining is that in the middle of the 20th century, the banks ranked neighborhoods on a scale of 1 to 4 using really racist criteria. And then they used these maps to determine what areas people could get loans in and what couldn't. And this drove a level of disinvestment in city neighborhoods. It drove a level of racist inequality in the housing market, who could buy houses and who was left renting. And it really touched off a level of urban disinvestment, and it touched off a level of multi-generational differences in the accumulation of real estate wealth. And there's a lot of research that shows that predicts a lot of other health outcomes, because where people live is a huge determinant of their health. So when we've published material explaining redlining and explaining how it affects housing and how systemic racism in the housing market, even though redlining was banned, how this stuff sort of is still has its effect in the world around us. We've seen a lot of people look at those resources. We get a lot of web traffic there, which means to us that a lot of people are using that lens to understand health and the city and the world around them. And that's really important to us.
Yeah, thank you for weaving that through line, seeing how like someone may not just have asthma because they have it, but it's their environment where they live, the conditions around where they live, the systemic issues around it. It's really intertwined. You mentioned the wildfires in New York, which I remember, like I live in New Jersey and it was just as bad over here. I think everyone who lived in the area really remembered it. But has there ever been a moment where you really saw a real world impact from your work, like a person or member of your community using your data to make an informed decision?
Yes, there have been several moments. It's always really, it feels great to sort of have this perspective that if we make the data easier to access, understand, and use, then more people will hopefully use it. We don't always get a chance to see that, but when we do, it's really validating. During the height of the COVID pandemic, I was working a lot on COVID data publishing. And in those first months of the pandemic, at some point we saw the epi curves on the Rachel Maddow show. And we were like, oh, we've made it, that was really cool. And then during the air quality situation, we saw our data and our approach to visualization republished in tons of news outlets, including the New York Times, which again is exactly what we want. If we think that these data provide a sort of critical look at an issue, then yes, we want others to reproduce our visualizations. And we track things like earned media, and we see things like the heat vulnerability index being used by more and more publications as a way to understand these issues of heat risk and the ways that structural and environmental factors affect people's heat risk. It's used really widely in media coverage of climate-related health outcomes and of advocacy. So it's wonderful to see that the more work that we do in order to make this material useful, the more we see it getting picked up and used to improve health and make change.
Since you've spent so much of your career dedicated to making data accessible and usable and understandable, how does it feel to see the work you do directly impacting New Yorkers' lives?
It feels good. I feel like there's always the hope that work will be effective, and you never really know. And sometimes it feels like a long chain in connecting like one data visualization to health outcomes. And sometimes you have to have a little bit of a leap of faith that if you do your job right and with thought and care, that you're helping to, make sure that all of the links in the chain that you can touch are intact. I'm a big believer that government agencies have, a huge responsibility to do their work well. We're funded by taxpayers, and we're working with this huge volume of data. And this data is about people in the city. It's about their lives and their bodies and their experiences. And when we use that data to create knowledge and plan work, I think we have a responsibility to communicate that information, the data and that knowledge in ways that other people can understand and use, and not just, we don't want to just sort of keep that inside the doors and the hallowed halls of government institutions. I think we have a significant responsibility to democratize access to that information and kind of shorten the gap between people and government administration. And I think that's really important now when there is such a significant lack of trust between people and government administration.
Absolutely. I couldn't have said it better myself. Looking to the future, you were mentioning how you iterate, you collect user research data to inform how you improve the portal. But how do you see the role of data communication evolving in public health and in environmental policy? I don't know if there are any innovations in data visualization or avenues for public engagement that can help move the needle forward, or what comes to mind?
It's interesting that you use the word innovation. I've been thinking about that word a lot lately. And I think that there's often a focus on innovation in government technology work, which is important. It's important for government agencies to stay with the times. But I think that sometimes the word that matters more to me is transformation. When we make change in government agencies, change trying to be more efficient and serve people better and improve health, sometimes we're not doing that with technological innovation. We're doing that by applying common sense standards that are maybe perfectly useful older standards. The technology that my team works with is not, I think, particularly innovative. We try and keep our technology as simple as possible. We don't use proprietary software. We don't use things with expensive licenses. We use free accounts and open source packages and a bunch of things that are interoperable. It's not really innovative, but it is transformative because it means that we can work with a bunch of different web development contractors to add or improve or change things without getting locked into one specific vendor. It means that we can build something new with one of these partners and we can bring it in-house and we can learn how to operate it so that we can update it, so that we can maintain it, so that we can improve it. All of this work is aligned with a move to simplify and improve government technology and civic technology and the services that reach people. And I think that the innovation is in not innovating. It's not talking about AI. It's not talking about, this flashy new thing or that flashy new thing. We're not creating a meme coin. We're just using open source technology. We're using the core languages of the internet to build something that works. And we know it works because we've talked to the people who use it and they tell us it works. That's the real innovation. That's the real transformation.
Truly. I mean, you're a team of 3 people.
3 of us, yeah.
Yeah, like the fact that you've been able to redesign your site provides so many different stories and pieces of information around like a variety of public health topics with 3 people. Like, it doesn't need to be a huge lift.
And it's hard. I think often in government work, there's the need to wear multiple hats and juggle multiple responsibilities. If you need something designed, you can't always go out and hire a designer. You have to figure out how to do it yourself. My team sometimes in our team meetings thinks like we take a look at what we're working on and we think we could be 6 people working on all of this, but we're only 3 people working on all of this. But I think that it's possible to make, design, development, technology choices that leverage small teams and their abilities and create something that you can deploy to good effect and maintain and use and that can really benefit people.
Yeah. Just hearing from you today, I've been getting, that this doesn't need to be rocket science. You can make it easy. You're striving for transparency, for trust. Amid all of this, what advice do you have for other government agencies or communicators who are also trying to improve public understanding of government data?
I think the first thing is to talk to people, talk to users. Put a thing on your website that asks people to enter their email address and start emailing them every now and then about new stuff, and then start emailing them asking for volunteers or compensating them, which is great, to sit down and talk about how they use the website, how they use the platform, how they use the service. What you will hear will surprise you. You never know what people are doing with your information until you ask them. And when you ask them, you start to get ideas about ways that you can improve. You can use those observations to inform the work that you'll do in the future. And then you can also use that process to test the work that you've done and see, okay, we built this thing. Does it work for people? And if not, how do we make it work for people? So talk to people. The other thing that teams can do is to look for lightweight solutions. Things that you can test and revise, work faster, prototype things, put things out in the world before they're perfect. You're never going to get things right on the first try. You're not going to hit a home run on the first swing. So get things out into the world, observe how they work with users and revise them. When you do things like that, you dramatically increase the likelihood of success because you're not putting all of your chips on the idea that you can build some new big platform, some big project or initiative that'll solve all your problems. You're starting small, you're observing what's successful, and then it allows you to sort of double down and pursue those moments of success. And that's so much more effective. It's so much more efficient. It's a little scarier, but it works.
Matthew, thank you so much. When I think about data, sometimes I think about how daunting and abstract it can be, but I think you've also shown us today that there are ways to make it pretty simple, understandable, and accessible. So thanks for giving us a little glimpse into how you make it happen in New York City.
Thanks so much for the opportunity. I really enjoyed being on here with you.
Walking away from today's conversation, there are a few takeaways I want to emphasize. 1, talk to your users. Continuously engage with them so you can iterate and get better. Then look for low lifts to design based on that feedback. What Matthew said about transforming user experience through simple solutions instead of bringing in shiny, big innovations, that really sticks with me. Finally, people want to be empowered. They want information they can easily get and understand so they can make informed decisions about their own well-being. Be the agent to help them do that. Thanks again to Matthew and his colleagues at the Department of Health and Mental Hygiene. I encourage you to check out the platform we mentioned today, the Environment and Health Data Portal, which we've linked to in the show notes. It's got some really awesome stories and a huge variety of topics about environmental health that you can learn about. If you liked today's episode, give us a follow and rating on your podcast platform of choice. And make sure to share the show with a friend. I hope you'll join us next time. Thanks, y'all.
Empathy Effect is a product of Forrest Marsh. You can reach us at forrestmarshmedia@forrestmarsh.com with any feedback, questions, or inquiries. If you want to know more about today's guest, are interested in participating with Forrest Marsh, or becoming part of our community, check out our show notes for more information.